Hello everyone. I welcome you all to this annual conference of the Ni3 Center for the Global Prevention of Gender-Based Violence, and specifically in this session about the School-Based Social Work Project. My name is Thomas Ssenfuuma. I'm the project coordinator of the School-Based Social Work Project, Ni3 Research Center housed in the Department of Social Work and Social Administration, Makerere University. My presentation layout, I'm going to discuss about the project background, provide a case study, feedback from the stakeholders such as children, then challenges faced during the implementation process, but also talk about the impact of COVID-19 on the well-being of children, especially those who went out of school. Then how about the way forward? Of course, the background, we conducted a psychosocial survey that is 9 in 3, which was conducted in 2018 that aimed at investigating the prevalence of child abuse and neglect in homes and schools and its associated psychological effects on the children and young people. And of course, from the study, we found out a number of violence against children that they are facing, such as maltreatment, physical, emotional, sexual abuse, such as forced sex, attempted sex, abusive touching, and many more. And of course, the other violence children faced was mental health difficulties, for instance, self harm, suicide attempt. So it was against such background that we came up with an idea of how we can try to support these children. It was after conducting the research, it was important that we go back and create an impact in those schools that we had engaged in the research project. So the gap was that despite the existence of the support structures that were in these schools, such as say the senior woman teachers, parents, guardians, and other stakeholders involved in child protection, the survivors of violence against children or gender-based violence did not seek for support from the available uh, individuals due to a number of reasons. One of them is fear, distrust, ignorance about the support services available, then of course weak support structures. So this led to the creation of development of school-based social work. I wanted to use an approach to transfer the social work knowledge and skills to these schools and support the children. Of course, we had an inauguration meeting with Professor Adele Jones in 2019 in January, where we discussed a number of things, how we are going to implement the project, and we developed a concept note around February 2019. And of course, the source of funding was vital in the process of trying to develop this project. And of course, the Ni3 Research Center provided us with some funds of about 8,900 US dollars, which is an equivalent of about 32 million Uganda shillings that we used in the course of implementing the project. And the aim of the school-based social work project was to contribute towards restoring social functioning of learners among selected schools utilizing the case management approach. Of course, the case management approach has a number of steps such as identification. You identify children or students with difficulties or challenges and then come up with solutions on how to support them. Then we talk about assessment. You assess to really find out what is the real problem, because you might have a presenting problem different from the real problem. So after finding out the real problem, then you develop, say, a work plan or a case plan on how you are going to support this child. In case, say, if it is counseling, you provide it there and then. If it needs another service provided by another service provider, then we can be able to refer. Then, after that, of course, our other objectives was to provide an opportunity to the social work undergraduate students to have hands-on experience, because we are working with undergraduate social work students within the schools. So it was an opportunity for them to learn, to transform the knowledge obtained from class into practice. Then, of course, to contribute towards the development of school-based social work within our schools, but more generally within the country. Of course, we had 4 participating schools because of the limited funds, and the location was Kampala, that was within the capital city, and it was closer to the university. Therefore, students could easily go to these schools, at least say once a day. So it was implemented in such a way that the social work students would go to each school once a day. So we had 4 participating schools. 3 were primary schools, 1 was a secondary school. And of course, the different stakeholders involved, we had the Department of Social Work and Social Administration, the 4 participating schools, we had the senior teachers within those schools, we had the government of Uganda, it was on board, that is through the Ministry of Gender, Labour and Social Development. We had Sauti 116, but also the police, because we would engage them on a number of occasions, especially on cases that involved sexual violence, as we shall see later. Then, of course, we had non-government organizations, for instance, Action Aid Uganda, which has a GBV shelter, and then also the learners as well as parents. Of course, the team was composed in such a way that we had a country director on top, that is the country director of Ni3. Then we had the research fellow, which is Dr. Esther Navka, was also very supportive in the process. Then the project social worker or coordinator, who in that case happens to be me. Then also we had volunteers, those were the social work undergraduate students. Of course, this project was implemented for a period of 6 months from May to November 2019. Then, of course, we are targeting 2 school terms, term 1 and term 2. Then also social workers will go there once a week. Of course, we had a training. We trained these social workers, and the training aimed at strengthening their knowledge in the field of counseling, but also child protection. And of course, we discussed a number of issues. It was a 2 days training. We looked at the understanding of childhood, child safeguarding and child protection, case management, and then school-based social work, counseling, and the code of conduct while in the field. Of course, we had data collection tools that we used in the process of engaging with the children. For instance, the case planning with children, guiding questions for assessment, we had the identification tool, incident report, and the referral form. Some of the ethical considerations we considered, of course, during the process of implementing the school-based social work project, we had to seek for permission from the relevant stakeholders, of course, from the government, but also from these schools. We reached out to them, and they offered us an opportunity to engage or work with their learners. But even then, when engaging with the children, we would seek for their assent. And also we emphasize issues of anonymity and confidentiality. For instance, in most of we opened up case files for these children whom we are working with, but we would not indicate their names. We had unique codes which we are using for purposes of privacy and confidentiality. In other words, if another person accessed the file, which did not happen, they would not know which child it was, but also the teachers did not know these children that we are working with. Then also, we're encouraging voluntary participation. We're not forcing anyone to seek for the services. Then, of course, we are not allowed to record anything in terms of audio recording, but also not taking photographs of children. When it came to information sharing, it was between us, the project staff, and also the legal authorities, for instance, police, as well as the Ministry of Gender, Labour and Social Development, that is the government. Then, of course, the code of conduct copied a number of things from the Code of Conduct for the National Association of Social Workers Uganda, and also the social work principles. Issues of social justice were put into consideration, dignity and worth of persons, that is treating each child as with dignity and respect, irrespective of who they are, irrespective of their gender, irrespective of their class, their tribe, their nationality. So we worked with everyone with acceptance. We let them to fully express their feelings. Issues of confidentiality were so strong, and self determination, whereby we are working with them to identify solutions, not us going there to take our solutions there. Then, of course, documentation and record keeping. Of course, we'll open up individual case files for each child or each client we engaged, which were stored in a safe lockable cabin at the office. And of course, we also enter this data electronically into a password protected computer, and we would share information via password protected drives or USB sticks. And of course, information was only accessed by authorized project staff. Of course, one of the key things we emphasized during the process was self-care, because at times you may experience burnout, especially when working with these children. If at all you listen to a number of stories, negative stories, so as a social worker, you need to really take care of yourself. And of course, we encourage self-awareness to understand, fully know what you are interested in, what are some of your weaknesses? What are your strengths during the process of engaging with the children? Then also encourage people to separate work from their personal life. Then also having adequate sleep, nutrition, exercise, engaging in recreation activities, seek for peer support, a number of things and that were conducted. Then also one of the cases we handled in the process, of course, there was this particular child who was about 12 years of age, and of course, she lost her father, and of course, she was in primary six. Her mother left her somewhere under the custody of the uncle. She had traveled abroad. Then the uncle also had disappeared, left her the child behind with another person, probably the wife to the uncle. So the wife also left the child behind with a neighbor. And of course, there's a gentleman who tried, that is a neighbor, who tried to defile her, actually defiled her. And then she tried to seek for support from the village defense security personnel, but in vain. She was advised to go to police. She walked to police at night. Then, of course, when the police came, they arrested the gentleman, but later he was released. So, when we went to the school, of course, we found out that the girl came and disclosed this information to one of the social workers. Actually, I think she had disclosed to the school staff, but they didn't know what to do. So, when this case came up, of course, we came on board. We had a case conferencing. We conducted a thorough assessment. We engaged, we called the Ministry of Gender, Labor and Social Development, that is Sauti 116. Of course, we discussed, and the best option was to rescue that child from that community, because the perpetrator, remember, was released by police. The perpetrator was within the community. Chances are high that she could face the perpetrator could maybe harm the child. So she was rescued and taken to a GBV shelter for protection, but also to reunite her with her biological mother. Of course, the shelter now took responsibility to ensure that she is reunited with the biological mother. So in the process, she was really very happy. And I remember during the process, they were about to do their exams. I drove to the school. We picked the exams, took the exams to the GBV shelter where she was. She did the exams and we took them back. And actually, she passed. She was really very happy. Then, of course, we have some feedback from the stakeholders. They were really happy about the project we implemented. This is a parent who said that I thank the social workers for the great job they are doing, because our children face a number of problems and sometimes they do not want to tell us. I believe we have such people at school. They can hope to provide counseling to children. In addition, I pray that they make follow ups in families and talk to parents as well, because we also need the service. So I remember attending one of a meeting where we had teachers and parents. They are also like, why don't you also talk to us parents, but also teachers are in need of this service? Then this is a primary five class teacher. She said, we really appreciate the work social workers are doing, because we have realized you handle issues which teachers cannot. And we deal with many students, thus focus on teaching. So you have really done a great job. Thanks a lot. So you find that teachers are overwhelmed. Instead of listening to individual stories or cases, they focus on teaching because they deal with a number of children. Then the head teacher from one of the schools, I thank the team of social workers from Makerere University, because they are helping our children faced with problems. They talk to them to find out the problems they face and work towards solutions. I encourage staff and parents to work with the social workers to ensure that our children are protected from harm. Then, of course, one of the students said, I would like to thank you, madam, that is the social worker, for the work done. I'm really so happy and grateful. I used to come from far to school, but now my parents took me to my auntie's place, which is closer to the school. And she's so caring. Hence, I get enough time to revise my books, and my performance has greatly improved. Of course, some of the challenges that we have faced during the process of implementing the project: limited coverage. Of course, we covered very few schools as opposed four schools as opposed to many schools in Uganda, but also those schools that participated in the research. Then there was a high demand for the project to be extended during the holiday period, because we implemented it during the process, during the period when students or children were attending school. Then, of course, work overload. We had a number of cases to handle, yet we had limited number of social work students. Then, of course, insufficient time spent in the field. Remember, it was 1 day per week, so that time was not really enough. We had a feeling that it could be maybe at least 2 days. Then, lack of financial resources to enable follow up on some cases, because it is really costly to follow up on all these cases. Then, of course, resistance due to a lack of clear understanding of the purpose of social work. Of course, in some schools that we approached initially, they didn't know what social workers do. So it was hard for them to allow us into their schools. Then budget constraints, of course. Then with COVID-19, it has really resulted into violence against children. There are some studies, recent studies, which have been conducted, one by FAWE, another one by AfriChild. And of course, as you can see, there has been increased adolescent pregnancies and marriages during the COVID-19 lockdown, limited access to learning opportunities and platforms, high dropout of candidates and finalists, increased risks associated with long, prolonged school closure, but also increased violence against children during COVID-19, because, and it was found out that actually few children are reporting abuse, because the perpetrators are with these children. It is the relatives, it is the parents, and the neighbors. So schools are always a good opportunity, a community where students can easily open up, especially to social workers. So now that the government is planning to reopen schools probably next year in January, there is need to have social work, prioritize school-based social work, prioritize, because this way we shall be encouraging students to provide counseling to these psychosocial support to these children or students after undergoing a lot of traumatizing events during the COVID-19 lockdown. So there's need to have school-based social work within the schools, especially after opening. Then, of course, uh, but of course, it has greatly contributed to the well-being of children. That is school-based social work, because some students registered improvement or reported improvement in the academic performance. Then there was also awareness creation, especially about children's rights and the available service providers. Then also it resulted into protection of children who are faced with harm, that is by linking them to the available service providers, but more generally improving the psychosocial well-being of children. But now the challenge is, despite all that, there is no evidence. That is why in the way forward, I'm saying that there is need to incorporate research in terms of implementing this unique approach to promoting the well-being of students within schools, to understand the effectiveness of school-based social work on the well-being of children. Because if at all we are saying some students reported improvement in the academic performance, we need now to use an evidence-based angle to engage with these children to find out whether it really does. Then also there's need to strengthen school-based social work within Ugandan schools. It is something which is interesting. Of course, this calls for more funds from potential donors to help us support the children, but also schools in terms of implementing the project. And also we call for collaboration and partnerships with key stakeholders, including the government of Uganda, the donors, the parents, the teachers, and all the relevant stakeholders, so that we contribute towards the well-being of the children. I once again thank you very much for listening in, but also I thank all the team that we worked with in the implementation of this project, the social work volunteers, our team leader, Dr. Erika Wich, the research fellow, Dr. Esther Namfuka, and other stakeholders from the Ministry of Gender, Labour and Social Development, as well as the Police of Uganda. Thank you very much. This marks the end of our session. Any questions are welcome. Thank you.